my name is Serenity, and I will be talking about the interior anatomy of a sheep heart. So this is the size of a sheep heart, and I'm going to be cutting into it with a scalpel. So this is what the sheep heart looks like when it's cut in half. And I'm just going to be going over some things that I missed in the last video. So the first one is the chordae tendineae. The chordae tendineae are these little strings, or some people call them heartstrings, and they're attached to the tricuspid and bicuspid, and they support the atrioventricular valve, the aortic semilunar valve, the bicuspid valve, and the tricuspid valve. And if you see over here in the right ventricle, this is the tricuspid valve, and it is attached to chordae tendineae. Next, I will be talking about the papillary muscle. This is the papillary muscle, and it's right here, and you can see it on the other side of the left ventricle. It is attached to the bottom of the chordae tendineae. Next is the trabecula. The trabecula looks like these little plate-like structures. You can see them in the left ventricle and in the right ventricle, if you just open up the right ventricle. This is the tricuspid valve. It's in the right ventricle. This prevents blood flowing back into the right atrium. This is the bicuspid valve. It's attached to chordae tendineae. It prevents blood flowing back into the left atrium when the left ventricle contracts. In the last video, I forgot to identify this part of the exterior of the heart, but this is the apex. It's just the bottom of the heart, and I forgot to identify that in my last heart dissection. And the last two, this is the interventricular septum. It's the thick wall that separates the left atrium, the left ventricle, from the right ventricle. And the aortic valve, I couldn't get a chance to talk about it in the last video, but the aortic valve is in here. It leads to the aorta. If I stick my probe in there, it leads to the aorta, and it prevents blood from flowing back into the wrong direction. Now at this heart, it was much easier to cut into, but it's more squished together. So with the cow heart, it was much easier to see the right atrium. With this one, you kind of have to pry it open. And the aortic valve and the brachiocephalic artery, they're more squished together. So I would probably suggest getting a bigger heart if you want to do a heart dissection. If you prefer a smaller heart, that's probably easier. That's fine too. And that's all I have for this video. So thank you. Please like and subscribe and share with people that you know that would be interested in watching my heart dissection. So thank you.